Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Noradrenaline. This noradrenaline is a powerful vasopressor agent. Noradrenaline is used in alpha 1, alpha 2 and beta 1 receptors. It is not used in beta 2 receptors. Now, because it is used in alpha 1 receptors, it causes vasoconstriction, thus increasing the diastolic blood pressure. Then it acts on beta 1 receptors and increases the systolic blood pressure. So, because of increase in both systolic and diastolic blood pressure, pulse pressure will always remain same or it is slightly reduced. Um, so, this also causes decreased heart rate is also seen. Now, there is increased mean arterial pressure is also seen and has a result in transplanted heart. In transplanted heart patients, there is tachycardia is seen. So in transplanted heart patients, there is no sympathetic supply has been lost and thus the patient will have tachycardia, and in order to reduce this response we have to do pre-atrophinization should be done, will reduce the response.
thank you and thank you for watching.